going to be talking about asthma. Imagine your chest tightening and every breath you take, you either wheeze or cough. You feel like you're going to suffocate. This is what it feels like for someone who has asthma. Asthma is a condition where your airways constrict and produce more mucus than normal, which makes it difficult to breathe. Asthma is a growing issue in the United States and affects about 34 million people. Anybody can get asthma. My mom has asthma and has made me wonder more about it, so I've done some more research. Asthma is a disease that is not as simple as most people think. I'm going to be talking about the many causes, symptoms, and treatments of asthma. To start off, I'm going to be talking about the different causes of asthma. Asthma can be caused by many different things such as allergens, viral infections, smoke inhalation, cold air, and exercise. Asthma is not brought on by the same thing for each person. Many of the causes can be caused by genetic factors. Allergies and asthma are very closely related. Exposure to substances that cause allergies can bring about the same signs for asthma. When you encounter a substance that you're allergic to, your immune system fights back and sends a message which causes problems in your respiratory area, which makes it harder to breathe. Exercise is another big trigger. According to the article, Exercise-Induced Asthma from the CME magazine, activities such as running and cycling, which require high-intensity exercise, are more likely to cause EIA, or exercise-induced asthma. Generally, the colder the climate and the more vigorous the exercise, the more rapid and severe. End quote. Cold air constricts your airways, which makes it harder to breathe because when you're exercising, it's already difficult to breathe, and then you add on asthma to that, and it's just really tiring. Next, I'm going to talk about the symptoms of asthma. Symptoms for asthma vary from person to person, and they may just happen at certain times. Some of the more basic symptoms include shortness of breath, tight chest, wheezing, or coughing. These symptoms may not be really noticeable at first or in mild cases of asthma. If you are already aware that you have asthma, signs that your asthma may be getting worse are the need to use an inhaler more often or more bothersome or noticeable symptoms that I mentioned earlier. According to the Mayo Clinic and the article Asthma, for some people, asthma signs and symptoms flare up in only certain situations. The most common situations are exercise-induced, occupational, and alcohol-induced. I've already talked about allergy and exercise-induced, but occupational is when you're at a work area and gas substances or other chemicals get into your airways. These symptoms do not occur all the time. Finally, I'm going to inform you about some of the treatments for asthma. There are various treatments for asthma, and it all depends on your preferences or how severe your asthma is. One option for treatments are quick relief medications, which are used with short-term symptoms like if you're having an asthma attack or before or after exercise. An example of this medication is oral corticosteroids, which do not always work because they are oral medications like pills, which if you need to take that and you're having an asthma attack, and they're in your purse or your wallet or whatever, you're going to have to dig through it, and you're already super stressed because you're having an asthma attack, which can be really hard to get it down. Another example is handheld inhalers or nebulizers, which convert asthma medications to a mist, which you inhale. These are the most common because they are portable and easy to use. This is an example of an inhaler. So to use it, all you have to do is take off the little cap that covers the mouth, you shake it, and you press down on this little thing, and you inhale all of the mist. There are also long-term asthma control medications. These medications are usually taken daily for prevention of asthma symptoms. Long-term medications can be taken orally or can be inhaled. Taking oral medications for the long term is a lot easier than for quick relief because you're not having an asthma attack and you have plenty of time to take the pills. Examples of oral medications are leukotriene modifiers such as Singulair. Inhaled medication examples are things you may see on commercials like Flonase or Symbicort. If your asthma is caused by allergies, there are specific allergy medications to help, which are given to you about every 2 to 4 weeks. The most common form of this is immunotherapy. According to Paul Potter in the article, New Developments in the Field of Allergy and Asthma, quote, in practice, sublingual immunotherapy, SLIT, has become a more convenient, very practical and effective treatment for allergic patients since it is extremely safe and can be conducted at home, end quote. It works for all different kinds of asthma. Another treatment is bronchial thermoplastic, which is not as common as the others because it doesn't work for everyone. This is when the insides of the airways are heated to reduce the amount of smooth muscle, which doesn't allow your airways to constrict as much. In conclusion, asthma is an increasing issue worldwide. Asthma has many causes, symptoms, and treatments that can be easily detected if one is informed and educated about them. Knowing what triggers asthma and providing the right treatment can prevent a lot of harm. Anybody in this world can get asthma, and knowing how to detect it can make it less damaging to one's health. Now that I have informed you of asthma, I hope that you will leave with a better understanding and awareness of it, because you never know if you